Well, the Health Policy Center was founded to be a place where we could study policy issues year-round for our state government and our legislature. And our legislature is part-time, so there wasn't always time to look fully and deeply at health issues. And so the Health Policy Center was founded to look year-round at issues for our state. But in the 30 years since our founding, we have expanded to provide this kind of evaluation, research, program development across the United States and in other countries. Over the years, the definition of health has broadened to be health and well-being, and thinking about things that are beyond just the basic needs for health and safety, thinking about education and transportation and housing and how people work and live in the thriving natural world, these vital conditions for health.
Back when we moved into the suite, they asked our director, Karen Minyard, to help to decorate. So they asked her what items would be appropriate. So she thought about bikes. When you think about bikes, you think about health, you think about fitness. So we wanted when our staff to come into the suite to see these items and know that we are working towards moving health forward and to stay active and positive at all times.
We partner a lot with our state agencies. One of the partnerships that I've been involved in nurturing is our partnership with our state Medicaid agency. It started out in a few areas, rural health, child health, and long-term care. Now this year we're working with them on the Rural Health Transformation Grant. So I've seen a lot of this work come full circle with that agency, and we've worked with many folks in different leadership positions over the years.
We work with the state government, we work with foundations, we work with the private sector. We're very active in individual communities. So it's a broad range of public and private partners and communities that come together to focus on thriving.
Georgia Thrive is a program where we look to change the service delivery for families who have children who have been taken away from home. And so what we look to do in Georgia Thrive is to help to promote family reunification by helping parents, caregivers, mothers or fathers, whoever will be caring for children that have been removed from their homes. So we work with the judicial system, we work with lawyers and advocates to provide and promote services through our Safe Babies court approach, where court is really redesigned. So MindWorks is a statewide collaborative that is made up of all of our child-serving state agencies who work together to connect the dots of the child and adolescent behavioral health system in Georgia. So our goal is to design, implement, and oversee the Georgia system of care, which serves children and families to meet their behavioral health needs. And our goal is to do that through policy, people, and through practice. We look for and are intentional about incorporating the lived experience voice in everything we do. So from MindWorks to Georgia Thrive to even the larger work that the Health Policy Center does abroad, because who better to say what is needed than someone who has actually walked the walk of what it is to need services and need to know how to navigate the system. Or if I'm a mom and my children have been taken away from me, who better than can give advice to how we need to design programs and services.
The foundation to a safe community is having a safe childhood. We absolutely have to change the way that we do business so that we are making certain that all of our children have safety, permanency, and well-being.
We received a 5-year grant from the Health Resources and Service Administration to implement Georgia Thrive in our state. And we've implemented it in 3 sites. So we have a site in Gwinnett, Troup, and Clark counties. But we're looking to be able to expand Georgia Thrive into all 159 counties in Georgia. We think it's really important that families have access to these resources and services that Georgia Thrive provides.
What we're doing is reinforcing the things that the parents do well. We are helping them to learn different approaches to the things that they are not doing well. We help get them connected to the appropriate services to deal with the issues. We know that it's very challenging to deal with substance use. It's very difficult to get into treatment to stay into treatment. We also know that there are co-occurring disorders and that we have to deal with the mental health issues. Maternal depression is quite common. That has a very negative impact on the development of an infant and a toddler.
We're seen as neutral conveners. We're able to bring together stakeholders who don't necessarily see the world in the same way, to have difficult conversations, and to utilize that data and information that we provide. I think we also have subject matter expertise. Over the last 30 years, we've managed to grow that in a way that on all matters related to health. What I'm excited at is the prospects of, over the next 10 or so years, expanding the way in which we do our work to include other topics that are probably a little bit more controversial. When we think about immigrant health, when we think about issues related to violence and violence prevention.
We're going to continue to grow. We're going to continue to adapt. We're going to continue to be innovative, and we're going to continue to be a relevant voice as it relates to public policy and public health here in the state of Georgia, as well as nationally. So I'm excited to see the transformative nature of what GHPC does over the next 30 years.